This is CareGiver Solutions.Info with Marcia Teele. Marcia will be hosting an hour of true stories and information, tips and updates of the latest research and necessary information in the caregiving field, focusing on you, the family caregiver. An Alzheimer's disease and dementia care expert, Marcia has 15 years of hands-on experience at Arden Courts, a leader in assisted living dementia communities here in the U.S. Marcia covers everything you need to know as a family caregiver, especially if you care for a loved one with Alzheimer's disease or other related dementia or chronic illness. If you have a friend or relative that is also a family caregiver, call them now. They won't want to miss a minute. And let them know they can watch on CareGiverSolutions.Info. And they can listen on WNN 1470 AM in South Florida or nationally on the iHeartRadio app. Now, sit back, relax, and learn from our host, Marcia Teele, as she brings information to you that may just be the caregiving solution you need.
Hi, everyone, and welcome to CareGiver Solutions.Info. I'm so glad you could join us this evening. However you are with us, whether you're listening on your radio, whether you're with us on your laptop and looking at us live on the website, CareGiverSolutions.Info, I want to welcome you to this show. We've been doing this for caregivers, and caregivers are learning a lot from this show because we have experts in the field of all kinds of different variety between healthcare, between elder law, social workers, doctors, all kinds of different disciplines, because caregiving is not easy and caregiving requires a lot of help. And so we want to help you. And especially this show is for caregivers who cannot get out and go to support groups. Maybe you don't drive. Maybe it's difficult for you to leave your loved one at home, and you can't get to seminars to learn or go to support groups to be there in person to get the help that you need. And so if you're like some other people that are in that same situation, I'm glad that you could be with us. And please share this with others that you know in that situation, because it could be a difference between life and death, literally, for some people. So I want to welcome you to the show, and today we're going to have another great show for you. It's January 12th, 2016, and so I hope that you all haven't broken too many of your New Year's resolutions yet. I know we all make them, and sometimes they last just a day or two, and sometimes they last a lot longer. And so if you have some New Year's resolutions and you've broken them, it's okay. Don't beat yourself up. But it's okay to also start new resolutions. Every day is a new day. And when you're a caregiver, you know, it's day by day. And it's hard to plan out too far into the future because you have to deal with what's in front of you and what's on your plate. So it's okay to start new every single day and try a new resolution. But I hope that your New Year's resolutions do include some brain health. And what do I mean by brain health? Brain health. We want to make some resolutions that's going to help our brain and help keep us in better shape going forward. And so, in general, we try to bring to you every week a little brain boosters. It might be a certain tip. It might be some advice. It might be something that you could do to either improve your memory or to maybe stretch it a little bit, something that's going to keep your brain going, because that's what basically controls our whole body is our brain. That's the big computer in our head, and we want to keep it healthy. So some of the things to think about if you're going to start some new resolutions or add to what you already have is include some brain health resolutions, such as reducing stress. That is a biggie. Stress can kill, as they say, and sometimes we as caregivers don't really realize how much stress we're under until we start to slow down and take care of ourselves. And everybody says, relax, take care of yourself. You're a caregiver. You got to take care of yourself first. But sometimes it's not really as easy to do as people might think. And so overall, what you're trying to do is reduce that stress, because caregivers do have a lot of stress, and anything that you can do for yourself to reduce that is going to help your brain, is going to help your brain function. Quit smoking, that's a given. Pretty much the experts say that whatever we do that's good for our heart is good for our brain. And so smoking is really bad for us, bad for our heart, our lungs, our circulatory system, and bad for the brain. So if you're a smoker, please try to quit. Get more sleep. Sleep is so, so important. The experts say that we should be getting between 7 and 9 hours of uninterrupted sleep per night. So if you're a caregiver and you're getting some sleep, but you're up all the time because your loved one gets up in the middle of the night and rummages around the house and you're afraid they're going to wander out the door, your sleep is not uninterrupted. If they don't get up, but you're sleeping with one eye open or one ear open, waiting for them to make a noise, waiting for them to stir, your sleep is not uninterrupted. And so we want to try to get some good uninterrupted sleep, however that might happen. So we want to work on that. Eat healthier. I mean, everybody wants to eat healthier for the new year, so you want to get your rainbow vegetables and fruits in. You want to cut back on, things that have high cholesterol and things that have a lot of fat and a lot of sugar, and just be healthier overall. So I know that's usually on everybody's list for healthier eating. We want to exercise at least 3 times a week for about 30 minutes or more and get our heart rate up, get pumping however you can do that. Go for a brisk walk, do a little exercise at home, whatever it takes to get your blood pumping, because the blood pumping is going to go get the blood to your brain. It's going to put the oxygen up there, and your brain's going to be better for that. So another thing you want to do for brain health is stimulate your brain by learning new things or doing new things. It's very important to not be stagnant. We want to continue to grow. We want to challenge our brain. We want to exercise it by thinking and thinking hard. So if you do a crossword puzzle and you're really good at it and you've been doing that for many years, you're probably not challenging your brain as much as you could. So you want to mix it up a little bit and try some Sudoku or some other kind of brain exercises, because you want to challenge yourself. You want to learn a new language. You want to read a section of the newspaper that maybe you don't usually read, because that's maybe something that's not as interesting to you, but it's going to challenge your brain so that you can focus and understand what you're reading, because it doesn't come easy to you. So things that don't come easy to you are things that are going to help your brain, and it's going to be better off all the way around. And of course, meaningful social time. You got to take time for yourself. You want to include friends and family, and being around others, being social, engaging in a social situation is going to also be good for you, for your psyche, for your brain, for better functioning, for a little bit of stress relief. So try to incorporate a little bit of that. And basically what we're talking about is getting balance. We want balance in our life. One of the things you should put on your list every year, and if you haven't done it, go ahead and call your primary care physician and make an appointment. Go get a checkup, have your blood taken, and see if you're okay. Because the best thing we can do is try to avoid problems. And when we don't take good care of ourselves and we don't get checked out and try to be ahead of what might be coming down the pike health-wise, it might land us in the hospital. And so when we return from a quick break, we're going to be talking to a social worker at a hospital who sees people that land in the emergency room every single day. And we're going to learn a lot from her. So we're going to take a quick break, come back right back, and stay tuned because it's going to be great.
Arden Courts is not just a place to live, it's a place to call home. Residential living combined with quality caregiving. This is the philosophy behind Arden Courts. Communities created exclusively for individuals with Alzheimer's disease and related dementia who would benefit from a safe and structured environment. For additional information about any of the unique services Arden Courts provides, call 888-478-2410 to locate a community nearest you. Inquire about our educational seminars, resource library, or support groups, or simply feel free to ask questions you may have about Alzheimer's and related dementias. At Arden Courts, we know, we understand, and we can help because memory care is all we do. Remember, call 888-478-2410 for additional information about any of the unique services Arden Courts provides. Make First Choice your first choice for home health care. First Choice is state certified for Medicare covered services such as medical treatment and rehabilitation. Qualified healthcare professionals come to your home and work closely with your doctor to build a care plan designed to get you back on your feet as soon as possible. Founded and operated by registered nurses, First Choice Home Health is dedicated to providing exceptional home health care. Their highly skilled medical professionals have the knowledge and ability to provide patients quality care. Call First Choice Home Health at 561-296-2770. That's 561-296-2770. And tell them you want them as your first choice. You are listening to your host, Marcia Teele, an Alzheimer's disease and dementia care expert on CareGiver Solutions.Info. If you have a question or wish to share a story, call into the show at 888-565-1470 and talk with Marcia. Now, back to Caregiver Solutions.
And we're back, and this week we're going to be talking about hospitalizations. Sometimes, in our life, if you haven't had the experience already, chances are you're going to either land yourself in the emergency room of the hospital, or the person that you're caring for is going to have to be rushed to the emergency room in a hospital. And that is very traumatic. So we want to talk about this because if we can be ahead of it and know what we need to do and what's going to happen when we're in that situation, it's going to make our experience a little less traumatic and a little easier for everyone. And that's what we're going to be talking about today. So here joining us is a social worker, and she is in the case management department of Delray Medical Center, local hospital here in South Florida. And her name is Michelle Briggs. Welcome, Michelle.
Well, thank you, Marcia. It's a pleasure.
Thank you for being here today. I know that you have been a social worker for about 23 years.
Yes, that is true.
So I'm sure in that length of time, you have probably seen it all, done it all, and it's probably something that, is part of you, because as a social worker, I know that you give it all, you put your heart into it. Social workers are so special. And I want to, first of all, compliment you and thank you for everything that you do for people every single day.
Thank you. I enjoy it immensely.
So that's the only thing that we want to do, is have a job that we enjoy, because if we enjoy our job, it makes every day worth getting up for and going to work. And you help so many people. And you are in a hospital setting, and I know through all your 23 years of being a social worker, you've always been in a medical setting, whether it's a nursing home or a hospital. So I think that you're the perfect person to help us understand what happens when someone lands in the hospital. So we're going to be talking about that today. We have caregivers that are caring for someone, and, things happen. People fall. People get scared when, they don't know what to do, and all of a sudden they find themselves calling 911. So we're going to walk through some scenarios, and you're going to be sharing with our viewers here some of the things that they can do and give them some tips. But the first thing that I would like to ask you, in a hospital, I know we have social workers, and I know there are case managers, and there's even discharge planners.
Yes.
And a lot of times it seems that those three disciplines kind of overlap, and sometimes people don't know who they should talk to and when. So before we really get into the nitty-gritty, can you explain the difference between a social worker and their job in a hospital and the case manager and their job in a hospital?
Yes, definitely. I work in a case management department. A registered nurse is a case manager, and that person is primarily going to be responsible for making sure the hospital is appropriately getting paid for the patient. They are going to be submitting clinical reviews to insurance companies, and they are going to be really checking to make sure the patient meets the criteria to be in a hospital setting. And they also do overlap with the social worker. They are assisting the social worker at times, but they are very focused on the insurance piece. The social worker has the training and the knowledge how to counsel patients, how to guide them through the process of getting into and out of the hospital and navigating the community resources and all of the different facilities and different home care type companies and medical equipment companies. they are the ones who are knowledgeable on how to really interact with all of the different vendors and facilities that a patient would need services from. So they are going to be the one who is going to talk to the family, and they are going to be talking to the patient and really assessing all of the needs that are involved in getting the patient safely discharged, getting them to the next level and figuring out their continuum of care, and really sort of being almost like a medical concierge to the patient and family.
So you're in a way an advocate also for that patient to make sure that they get what they need coming in and going out.
Yes, very much so. I believe somewhere in my job description it says that I'm to be an ambassador for the patient and the family. And really, I take that seriously in the sense that you're really spending a great deal of time just really getting to know the patient and the family, getting to know what are their needs, what are their barriers to discharge, how were they living before they came into the hospital setting, and what are they going to need in order to get back to, that level of care that they might have been at before the hospital. And sometimes it becomes unrealistic for them to go back to that level. And that's where the social worker is really helping the patient and family figure out what do they need to be getting from the community, from different resources and vendors, so they can go on to either a rehabilitative process or some type of a long-term care facility for a new living environment.
So do you get involved with the patient from the very beginning, or do you get involved later, right before they're getting ready to be discharged?
Discharge planning really begins when the ambulance is taking the patient off of the stretcher and transferring them into their ER bed. So there is a case manager in the ER, and that person does some of the social work function in the sense that they will go in and they will do an assessment of the patient and start to figure out, what is going to be the next step for this patient and family, and start to really gather some important data, find out how many medications they were on before, find out who is bathing and dressing that patient, who's cooking and cleaning for that patient, what was their level of function at home? Could they walk? Could they get in and out of a car? Did they use some kind of transportation in the community? And sort of figure out what did they do before and really get that roadmap started. So when they get to a floor and they get admitted to an actual floor in the hospital, the social worker for that specific floor is going to basically take that roadmap and start, really moving them through the system and picking up the ball and working with the team.
So when someone does come to the ER, all those questions are so important because they're actually gathering all this information to give to you as the social worker to see how best to meet their needs.
Yes. And, you definitely find there are going to be a couple of different patients. There are going to be the patients that have gone through things before, so they know what to expect and they're used to the system and they start to know how to interact. But then you're going to get the patient who may not even be from around here, maybe from out of town, and really just doesn't have a working knowledge of how to interact with the system. And they are very much coming in with blinders and needing as much guidance and hand-holding as possible. So to make that easier for them, really there's a lot they can do to prepare. I mean, they really have to know their medications and or have them written down and be bringing them in to the hospital and sharing that information with staff.
So we're going to pretend that we're talking to people that have the blinders on, the people that are not experienced with
Sure.
going to the ER. And this is exactly what we want to share from your perspective. What's going to help them from the get-go, to make everything easier for the doctors that have to care for them, the nurses, make their stay better. So number one, first thing is have a list of medications.
Definitely.
And if they don't walk around with medications in their pocket, then maybe having somebody with you that knows the medications that you're on.
Yes, definitely. I mean, at a minimum, they should at least be carrying around their doctor's phone number. So they would know how to point the caregiver in the hospital ER in some direction for being able to have that information faxed over. So even if they're not carrying around in their wallet or in their purse a list of their medications, they would want to be carrying maybe a cell phone where their family member or their loved one or neighbor could even program, in case of emergency, call my primary care physician and get my medications, faxed. So that's one way they can prepare.
It's called ICE, right?
Yes.
In case of emergencies,
emergency.
ICE for short. So everyone should have an ICE in their phone, and that's your designated in case of emergency go-to person that you want the emergency personnel to contact, whether it's the hospital, whether it's the ambulance drivers, whoever is able to get that first. So that's very important information. And I have that, in case of emergency. The first thing is what they're going to look for when you end up in the ER. And a lot of people have caregiving responsibilities. And I know I've experienced, this with some of my family members. Before a caregiver placed her husband in our dementia-assisted living, she had gone around and looked at different places and decided that Arden Courts was where she was going to be when she needed it. And, when she needed it for her husband. But it turned out that she needed it sooner than he did because she was the one, as the caregiver, that landed in the hospital. I think it was the stress of the caregiving. She pretty much just went down one night and she couldn't function. And it was late at night and they had to call 911. And fortunately, she had a neighbor next door that could come over and stay with her husband. So when she went to the hospital. But we want to talk about how to be prepared for cases like this, because when someone goes to the hospital, you're going to have responsibilities at home that you need to be prepared that way too. So not only do you want to make sure that you have, in case of emergency contact, you want to have a list of medications, but you also need to have a backup plan so that if, gosh forbid, you had to go to the hospital, who's going to take care of your loved one? Who's in charge? And I ended up going to the hospital to the lady's bedside, the wife's bedside, and luckily she was able to actually sign some paperwork so we could get her husband into a safe setting while she was recuperating. And I'm probably pretty certain that you've seen this a lot, where people end up in the hospital and either no one knows what's going on with them, or the caregiver sometimes is so rattled that they don't even have the ability to communicate with you. And what other tips besides having the doctor's phone number on you and in case of emergency contact, what other tips would be helpful for people to prepare with?
I think another good tip would be that if you're in the community and you're co-caregiving, you're caregiving for your husband or vice versa, your husband's caring for you, you would want to already figure out who is your support system, and you would want to talk to your support system. It could be neighbors, it could be friends, it could be a family member out of state, and you would want to communicate with them. Okay, if something happens and I end up in the hospital, I'm going to need you to take, my documents about my healthcare directives, whether or not I want, to be resuscitated or not be resuscitated. And I would want you to take that information and fax it. I would want you to take my loved one who I'm caring for, and I would want you to put her in an assisted living in like a respite program while I get the care I need in the hospital. So you'd want to have a little bit of research done in the community beforehand. You might want to talk to an elder law attorney. If there were money, questions involved, you might want to go tour a facility and find out which facilities have respite programs available. Or you might want to look into private duty caregiving, and you might want to reach out to 2 or 3 companies in the community that have licensed, certified, insured, and bonded caregiver personnel that could easily come into your home, for $13 to $18 an hour and take care of your loved one if you end up in the hospital and you can't take care of your responsibilities.
Right. That's very good information because all of that happens every day. We see this scenario repeated over and over again. And of course, one of the things that Arden Courts is proud of is that we do emergency respite, and we do have that available, case by case basis if we have the room. We do work with a lot of home health companies, and so it's your job to coordinate all this and help them and give them those resources if they don't have it. So
yes,
you're
definitely.
really the go-to person. I mean, the social worker.
Yes.
You're like Oz. Is like you know it all and have it all available. So those are some really, really good tips. What happens once someone comes into the hospital? Let's talk a few minutes about triage.
Okay.
Because I know a lot of people go to the ER and they complain that it's been a long time before maybe anybody has gotten to them. And it can be hard when you have a loved one who has dementia, Alzheimer's or other dementia, that end up in a setting where they have to be patient, and
Yes.
it's not necessarily a secure setting, and someone has to be with them to keep them from wandering out the door, and they're there for a long time. Explain why that might be, why they're in the ER a long time.
Well, there can be a lot of factors. It can have to do with the types of tests that are being ordered. It can have to do with the specific doctor that is on the case. They may have consulted with other specialists that may need to come in and take a look at a certain symptom or variable that's involved. There could be an issue with getting the person into the appropriate bed or floor they need to be on. They may need to wait for us. May need to go to an ICU bed and wait for that specific level of care to be available to them. So the wait can at times seem long for patients for those reasons.
So in season, especially down here in South Florida, I mean, it is possible that the hospital, every single bed is full.
That does happen. It can happen. It's not a situation, that we see every day, but there are plans that are put into place if that happens. If a hospital, not just the one I work in, but if any hospital were to be quote unquote overcrowded, there would be a diversion plan where a patient, if they needed a certain level of care that couldn't be provided at that time, there would be a plan to make sure that patient was treated appropriately elsewhere.
Right. So basically, we want to say be patient because, well, that's no pun intended. As a patient, be patient when you're in the ER because there's a lot going on behind the scenes that you don't realize what's happening.
That's true.
So if a caregiver is there with their loved one and it's been quite a long time, how should they approach someone in the hospital and who to talk to find out what's going on? Who would let them know what's happening?
Well, really in an ER, it's going to be that patient's floor nurse, the nurse that is assigned to that patient that's going to be helping them to understand their tests that are being ordered and what's kind of coming next. But that nurse also would be someone who would identify a high-risk patient, who would be talking to the patient and saying, is there a situation at home that we might need to be aware of so that we can, get the appropriate person on the phone with your family or your loved one. So it's really in the ER, it's going to be more the nurse than anyone.
Okay.
There is going to be a case manager assigned to the ER, and that person is available to really get involved with sort of the high-risk patient, the patient that may have a loved one at home that's needing to have care, or maybe a placement issue that needs to be started right away.
Right. That's very, very critical. Well, what's wonderful information. Thank you,
Okay.
Michelle. And we're going to take a little break. And when we come back, we're going to learn more good information from Michelle, social worker and case management at a local hospital for information. This probably would be the same type of information that you would need in any hospital, no matter where you are. And so it's really good to have information to be prepared in case you find yourself or your loved one ended up in an ER. So we'll be right back after this commercial break.
Do you need the advice of an elder law attorney, but perhaps find it difficult or overwhelming getting to appointments? The solution is the Elder Law Department. They bring elder law, to you by meeting with you in the comfort of your own surroundings to discuss your personal situation and family needs. In practice since 1994, Heidi Friedman is a member of the Elder Law section of the Florida Bar. She and her team help families with issues that include incapacity and estate planning, asset preservation, veterans benefits, and other legal issues that seniors may face. Call the Elder Law Department at 954-383-1143. 954-383-1143. They bring elder law to you. Make First Choice your first choice for home health care. First Choice is state certified for Medicare covered services such as medical treatment and rehabilitation. Qualified healthcare professionals come to your home and work closely with your doctor to build a care plan designed to get you back on your feet as soon as possible. Founded and operated by registered nurses, First Choice Home Health is dedicated to providing exceptional home health care. Their highly skilled medical professionals have the knowledge and ability to provide patients quality care. Call First Choice Home Health at 561-296-2770. That's 561-296-2770. And tell them you want them as your first choice. You are listening to your host, Marcia Teele, an Alzheimer's disease and dementia care expert on CareGiver Solutions.Info. If you have a question or wish to share a story, call into the show at 888-565-1470 and talk with Marcia. Now, back to CareGiver Solutions.
I want to thank our national sponsor, Arden Courts, Memory Care Community. They're all across the United States, and they make the show possible so that we can share with caregivers this information that is so, so critical. And one of the things that Arden Courts can help you with is the short-term respite stay that Michelle was talking to us about right before we went to commercial break. And if you want to find out more about that, you can call Arden Courts. They have a toll-free number, which is the 888-478-2410. Ask them about respite stay. They'll even give you a free day of respite just to try it out, just to see what it's like. Have your loved one come into a nice, safe, caring, secure environment, and you can have a free day to yourself, and they can also have some activities and some socialization opportunities, and you both would benefit from that. Another thing that Arden Courts would like to offer you as a caregiver just for listening to this show is a free book. This is the 36-hour day. It is written by Dr. Peter Rabins and Nancy Mace. This is the 5th edition. This is one of the latest and greatest books out there. It's been updated, and it is considered the go-to book for caregivers because caregivers can cram 36 hours into a 24-hour day because of all the responsibilities that they have. So therefore, you want to get this book, read it. You can look at different chapters that are applicable to your situation or read it from front to back. It's a very good read, and I recommend it highly. So if you'd like to get your free copy of this book, just call the toll-free number of Arden Courts. Let them know that you heard about the offer on CareGiver Solutions.Info program, and they'll be happy to get one in the mail to you. So give them a call, 888-478-2410, and ask for the free 36-hour day. So we're back here with Michelle Briggs. Michelle is a social worker at Delray Medical Hospital here in South Florida, and she's sharing with us what happens when we end up at the ER and then what happens after that, and giving us tips on what we need to know. So this is really good, Michelle. Thank you so much again for being here. So now we've gotten through the emergency room. They've assigned us to a floor, and then what happens next on the floor?
So once the patient is admitted into the hospital and they actually get a bed on the floor, they're going to start interacting with staff from all different parts of the hospital, which for some patients, it can start to become a little overwhelming. They're obviously going to have their nurse, and they're going to have their primary doctor, and they're going to have different consultants, and those are going to be specialists, doctors that are specializing in different areas of different areas of medicine, neurologists, cardiologists, infectious disease specialists.
Whatever your problem seems to be.
Whatever your problem is, orthopedics, et cetera. And you're going to see a lot of different people, but you're definitely going to be seeing a social worker within the first day of your stay in the hospital. And that person is going to be coming into the room and really talking to you and helping you figure out what are your barriers to discharge. How did you get here, and who's with you at home? Are you a caregiver or is someone caring for you? And how are you functioning? And who's caring? Who is coming in? Do you have home care coming in? Do you have a medical equipment supplier that's bringing in oxygen or coming in and refilling, diabetic supplies? And really finding out who's involved in that person's life. Reaching out to family, talking to the patient's family, and really figuring out what are the goals of the transition of care. So, you get a couple of scenarios. You get patients that are going to go home at the same level of care, independent, they had no change. But then you're also going to have many patients that are coming in, they've had a major change in their condition, and they may have all of a sudden their mental status is altered, and they're really not making all of their decisions very soundly, and they're needing support from family. So that's where you really want to be prepared, and you want to have a family member or a neighbor or a friend identified to be a surrogate of some type, a POA, power of attorney, or healthcare surrogate or healthcare proxy. And you want to be able to communicate either verbally or with paperwork to the staff that there are people that, the social worker should be calling to plan the next step for you.
So what happens, Michelle? You mentioned about having these legal documents and someone who can speak for you in the event that you can't speak for yourself in the case of someone with Alzheimer's, not comprehending. Well, what if the person with the inability to communicate and make their own decisions, the person that's with them, let's say that's a neighbor, all right, and there is a need for a medical decision. That neighbor can't make that medical decision.
No.
They're not authorized. They're not qualified. You have to talk to someone who has the authorization, and that's why those documents are so important.
Yes, it's so important that, say there could, in many, many situations, that patient most likely has a relative out of town, and more often than not, that is going to be a relative in the Northeast somewhere, because we get a lot of snowbirds, and there's a lot of people here that have sons and daughters living out of state. And if you have that document that's listing your family, maybe a son or a daughter or brother or sister living out of state, then automatically the social worker knows to go ahead and read the chart and know everything that's going on as well as possible, and then contact that out-of-state family member and really start to review and all of the different options that are going to be existing as far as how to safely move them out of the hospital.
But there's been a lot of situations where, let's say, partners are living together and they're not legally married and they don't have any of the legal forms, but they've been together for 20 years. And they want to know what's going on. They want updates. They want to know what the test results were. What did the doctor say? What's going to happen next? Can you tell them?
That gets murky. If there is an out-of-town family member that is a relative, that person really is going to have to let us know if it's okay to talk to someone who may be claiming to be sort of a live-in significant other. And we definitely have had situations where the family out of town, they want to be sort of absolved of a lot of responsibility, and there may be a significant other that has been in the picture for 10 or 20 years. And as long as there's some kind of permission being given from a relative, then that type of situation is definitely permitted.
Okay,
with careful documentation.
Okay, so you can kind of get around that because that's what they would consider under HIPAA regulations and HIPAA law. Can you, to everyone in a layman's term, explain what that is? Everybody hears about HIPAA, HIPAA is a privacy law, but can you explain to everybody simply what does that exactly mean?
Yes, basically what it is it's protecting the patient's right to their privacy, and everyone has the right to their healthcare privacy, whether that be the test results or lab work, discussions with doctors, psychiatric documentation in a file. And if I don't want to share my results with anyone, I have the right to keep it to myself. And if I would like to share it, I do need to make that clear in documentation that it is okay to share protected health information with someone. Many times you'll even get a patient or family that will ask to have their chart after they're discharged, and that's acceptable. That needs to actually happen through the medical records department, which is health information management, and they would actually have to sign a release in order to allow the hospital to prepare and distribute that record either to the patient or family, or maybe an out-of-town family member, or even a doctor in the community. They would have to give permission and consent for that. So it is highly protected.
Right. And it's important. So that's why you sign HIPAA forms at the doctor's office, in the hospital, because they want to protect you. It's not just that they're giving you more paperwork to do. And speaking of doctors in the hospital, sometimes the person's primary care physician is not going to be the one that's sort of overseeing everything that's happening. Sometimes they have what they call hospitalists.
That's true.
Okay. So explain what a hospitalist is and what do they do, and how does that differ from your own primary care physician?
Sure. Well, basically what that is you may have a doctor in the community that simply has chosen to not practice medicine in your hospital. They may only wish to do community physician work, and they contract with the hospitalist in the hospital. And the hospitalist is a person who basically is like a representative for your community physician, and they take your case and run with it. So they take over and they become your sort of temporary doctor while you're in the hospital, and they manage your, day-to-day medical affairs on behalf of your community physician. And they do communicate with your community physician. They do call and ask about your background, and they do ask to have prior test results and prior labs and things like of that nature sent in for review, but they mainly take over the case for the period of time that the patient is admitted into the hospital organization.
So be aware, your own doctor may not be seeing you in the hospital. I think that sometimes is a little disconcerting for some people. They want their doctor to know everything and be there. So one of the things that a person could ask their doctor is, do you have privileges at the hospital? Do you go into the hospital?
Yes.
Because if I end up in the hospital, I want you there and not a strange doctor. And some people are funny that way, and that's what they want. So, if you're choosing a primary care, that would be a question to ask them, correct?
Yeah, that falls into the pre-planning category. When you're out there and you are looking at your physicians and needing to make those decisions and make changes, you would want to talk to your doctor, and you'd want to find out, which hospitals do you attend at? You may only, want to be associated with a doctor that goes to 2 or 3 that live near you, that are geographically near your home. And if that's not the case, you might want to think about switching to someone, if you're not comfortable, that you may get assigned a hospitalist when you're admitted in the hospital.
Yeah, so that's important too. We want to prepare and plan.
Yes.
Hopefully we never end up in the hospital, but we want to prepare and plan in case we do. So already we know, choose your doctors wisely. We want to make sure that you have your legal documents in place and that you have someone who can get those documents to the hospital if you're not able to do it yourself. What is another good tip for someone to know, or what's a common thing that people don't think of when they're coming to the hospital and they're in this situation?
Well, I think they're not really thinking that there is a next step, and that the hospital is obviously going to have to think about where they can send you when you're ready to leave an acute care setting. So there are lots of things that can be done in other settings, and a lot of misnomers are patients are thinking, in the old days, I stayed in the hospital for 2 or 3 weeks until I felt good, and then I went home. Whereas now there are organizations that are in place in the community that can take over the care of the patient when they no longer really meet that criteria. So a lot of times I think the biggest misconception is they really don't realize that there is going to be an end to their stay, and they are going to need to make some really sound choices for what comes next.
Correct. Well, I think that touches on another subject that's really difficult for some people to grasp and to understand, because the hospital, they're not going to, like you say, keep you for weeks on end and just until you feel better.
Yes,
they want to get you in, take care of your problem, get you out to the most appropriate setting.
Yes.
And so therefore you might be in, 1 day, 2 days, 3 days. There is a misconception, I think, that people that go into the hospital that have been in the hospital for 3 days or longer are entitled to go into a skilled nursing facility to get physical therapy, speech therapy, that it's automatic if they've been in the hospital for 3 days. But there's some new information that I want to share with everybody out there, because that might have been the case and it's not really admission.
Right. And there is a status called observation. Lots of folks are hearing about now. And basically what that is that's a patient who most likely is only going to need to be treated in the hospital for 1 to 2 days maximum. And that patient is there for, potentially tests that don't really require the patient to be rolled to what's considered a full inpatient status. And Medicare is very strict about go to a skilled nursing facility, and the Medicare benefit specifically says that you must have 3 qualifying midnights in an acute care setting before you can be eligible and qualify to be in a nursing and rehab center and have Medicare pick up that financial responsibility. So it requires, on the part of case management and social work and the hospital, a great deal of education and really talking to the patient and really helping them to sort of absorb that you may not qualify to go to a rehab facility just because you've been in the hospital. And there are other solutions, and that's really what the social worker is positioned to do, is to help you figure out the different options to safely leave.
So, Michelle, what would be an example of someone who goes to the hospital and they're there for several days and they're considered observation status? They're not technically admitted. What would be an example of that happening? Do you have something you can share with us?
Well, first of all, we normally a patient isn't going to stay in observation status more than 48 hours. That's something that's carefully monitored by case management. So if the patient ends up being there as an observation patient, you could be a pelvic fracture and not be a full inpatient admission, yet your day-to-day functioning is going to be severely impaired, and you don't meet the criteria to go to a skilled nursing and rehab center.
Wow.
So there are other types of organizations that have bine positioned in the community to help a patient like that. And that kind of a facility is called acute rehabilitation. And there are a few. There's Pinecrest, there's Cornell, Health South, Memorial Rehab in Hollywood. And those types of facilities are a step-down level of care from the hospital, but they're still considered a 24/7 healthcare environment that can help the patient basically return to their optimum level of functioning.
Okay, that's good information to know. I know that can be very confusing. So one of the things that maybe you want to ask is, is this a full admission? What am I responsible for paying? What is Medicare responsible for paying? What am I entitled to? It can get a little tricky.
Yes.
Yeah. So good stuff. So we're going to take our last commercial break, and we're going to be right back with Michelle from case management department as a social worker, sharing all the ins and outs of being in the hospital with us. So we'll be right back.
Do you need the advice of an elder law attorney, but perhaps find it difficult or overwhelming getting to appointments? The solution is the Elder Law Department. We bring elder law to you by meeting with you in the comfort of your own surroundings to discuss your situation and family needs. In practice since 1994, Heidi Friedman is a member of the Elder Law section of the Florida Bar. She and her team help families with issues that include incapacity and estate planning, asset preservation, veterans benefits, and other legal issues that seniors may face. Call the Elder Law Department at 954-383-1143, 954-383-1143. They bring elder law to you. Arden Courts is not just a place to live. It's a place to call home. Residential living combined with quality caregiving. This is the philosophy behind Arden Courts. Communities created exclusively for individuals with Alzheimer's disease and related dementia who would benefit from a safe and structured environment. For additional information about any of the unique services Arden Courts provides, call 888-478-2410 to locate a community nearest you. Inquire about our educational seminars, resource library, ask questions you may have about Alzheimer's and related dementias at Arden Courts. 888-478-2410 for additional information about any of the unique services Arden Courts provides. You are listening to your host, Marcia Teele, an Alzheimer's disease and dementia care expert on CareGiverSolutions.Info. If you have a question or wish to share a story, call into the show at 888-565-1470 and talk with Marcia. Now, back to Caregiver Solutions.
And we're here with Michelle Briggs from Delray Medical. And she is sharing with us her expertise. She's a social worker in the case management department at Delray Medical. And Michelle, let's talk about now that we've been in the hospital. We had our time with the doctors. They did the tests. They gave us the right medicine. They did everything they could do for us in the hospital. And now it's time for us to leave the hospital. But perhaps this is a point where, let's say someone with dementia had an episode and the doctors felt that it was important for them to be discharged to a skilled nursing facility prior to going back home. And that could be in itself overwhelming because now the caregiver has to say, well, how do I do that? How do I know who to choose? How does it work? How do I know what happens? So again, your job, you're there, the social worker, to help them through that transition. So you're the one that really helps them and tells them what the next step and walks them through it, right?
Yes, absolutely. So the social worker is going to be so instrumental in really sitting down with that loved one, with that family member, and giving them choices and walking them through how to make a choice, because lots of times families are so overwhelmed, they would just like the facility, the hospital, to say, and many of the larger chain facilities actually do send a liaison into the facility to meet with the family members and to really answer questions about what their setting is like and what they need to bring and what the continuum of care will be like for that patient. So really it's a lot of education and giving choices and really setting up the whole referral process for them and sending the appropriate clinical documents, and really also just encouraging them to know that everything that's been done in the hospital, all of that information will be disseminated to the facility so we can assure them everything that's been done is going to follow them. And that way, when they get to the rehab center where they're going to have some rehab, the physical therapy or occupational therapy, that the nurses that will be taking over actually have that roadmap that's following them. We call it the transition of care. Transition of care, yes.
And knowing what's been, because there can be a big disconnect if that doesn't happen. And,
it's so important.
It is very, very important.
So we use a computerized referral system, and we ensure that all of those protected health records are sent, and we communicate with the facility, and we give a report on the patient, and we make sure the facility that's taking the patient is an appropriate facility, especially for a dementia patient who may also have a physical need, maybe a cardiac need or some type of an orthopedic need or equipment need. So we also really want to make sure that we're finding a place that's going to be appropriate and not misdirecting them. So a dementia patient, we really want to make sure we're telling the family which facilities are going to be equipped to handle maybe a patient who has a history of wandering, maybe a patient who has a little bit of agitation, or really needs a lot of like one-on-one programming
for cueing and help with helping them with all their activities of daily living, which is bathing, dressing, toileting, grooming, all of that. And I know that we work very closely with Delray Medical, and Arden Courts is one of the choices, and we're very happy that we're a choice for the families, because it's important, like you say, to get to the right place, someplace that can meet all of those needs, and work very closely with the discharge planner and the social worker to make it all happen. You want to you want to be as seamless as possible and as easy as possible for the families. And that's why we're so grateful to be able to have wonderful social workers like yourself at the hospitals that we can work with and help these families. It's not easy. So that being said, any last words of advice or anything that you want to tell everybody that they should just really focus on at this point after we've talked about the hospital stay?
Sure. I would just like to say that, there are so many community lecture series available, and it's very important to really go out and really meet different types of specialists and meet different vendors and different liaisons from organizations and attend those health fairs and really start to figure out what's available to you so that if you need to plan later on, you're not planning in the middle of the crisis. You have some working knowledge of how to start getting your loved one or getting yourself transitioned out of a hospital setting when you no longer need that setting.
That's very good advice. And I know that the hospital does have educational series.
Yes.
You advertise them in the newspaper. It's free. You just have to RSVP, show up. I've actually attended some of those, and they're wonderful because you do get to hear different doctors talk about their expertise. You never know when you're going to need a cardiologist or a gastroenterologist. And you see somebody, you really like what they have to say, and you feel like you trust them, and maybe they would be your doctor. So if you know who you would want, I think a lot of times you can actually tell the hospital who you would like as long as they have privileges at the hospital.
Yes, definitely.
It's very important to do that and get out in the community and educate yourself. So thank you again, Michelle, for being with us. Stay with us. Next week, we will be here, same time, same place. Don't forget to call Arden Courts for your free 36-hour day book. And I hope that you remember, in the meantime, to take care of yourself, but also give someone a hug. They need it, and so do you. So bye-bye for now. We'll see you next time. Take care.
Thanks for joining us for this week's Caregiver Solutions with Marcia Teele. Join us next week as Marcia, who has 15 years of Alzheimer's disease and dementia care experience, brings you more needed information to help with the care of your loved one. This show can be seen again on CareGiver Solutions.Info, and questions can be left on the